Good morning, everybody, and thank you for joining us. I am Dee Dee Thatcher from Mental Health Association of San Francisco. I'm the Associate Director of Workforce and Training, and what I'm going to be talking about today are a couple of our programs under the MHASF umbrella. That would be Propel and Tech at Hand. And our primary focus today is going to be on how we are empowering peers' futures through advocacy and career counseling, the digital equity initiatives, and then also the Medi-Cal peer support specialist training and placement, some of the lessons that we've learned or some of our successes and some of our challenges. So again, welcome, thank you, and we, as Colin mentioned, will be taking questions in the chat and be stopping during or between slides to allow for some questions that are relevant to that particular topic. So we'll go ahead and get started. And again, thank you for being here. So let me just get my next slide up here. So Mental Health Association of San Francisco, our mission is to cultivate peer leadership, build community, and advance social justice and mental health. Our programs that I referenced earlier are under the Department of Education and Innovation, and that would be Propel, Training Institute, and Tech at Hand. And I apologize. I'm just going to start my timer here, make sure I'm on time. Okay, yeah, about me, Dee Dee Thatcher, Associate Director of Workforce and Training. I do identify as a peer with lived experience, and I do pride myself on being a leader with quite a bit of experience in management, organizational, and infrastructure development. I do advocate for socially responsible leadership and mentoring. I do my best to reach out and help folks and share some of my experience in my lifetime as a peer. And I'm just really inspired by the folks that I work with, as well as the people that we engage with in the broader peer community. If you want to contact me, you can do so at dd@mentalhealthsf.org. Our discussion topics today are going to be around an advocacy-based workforce development and training program that we are using in Propel. It is something that we have evolved to, and I'm really happy to be able to share with you how that is working for us and what that looks like for us. Then also providing advocacy-based career counseling and a peer supportive role. This is something that's really important to us, that advocacy is action. It is not awareness, right? It is not something that we just know that we need to do. We know that we need to actually do it. And then bridging the digital divide. We do know that the digital divide or inequity affects our peers who are attempting to advocate for themselves and enter the peer workforce. So we do address that through a laptop and tablet distribution programs or programs that we offer. And then our Medi-Cal peer support specialist training and placement experiences. I know a lot of people here probably know about this, and that there have been definitely it's been a journey for us, lessons as we go, and in how we can help peers engage with this opportunity to expand the peer workforce. So some of our successes, challenges, and case studies as well. So what is Propel? Propel has been around MHASF for many years, and it is a program that has evolved. Again, kind of back to the Medi-Cal peer support specialist training and certification. When this program was really made available broadly in California, Propel was able to kind of expand its mission and its services, and through that, this program has grown to what it is now, and that is providing advocacy-based career counseling services for folks who want to work in the peer and supportive workspaces. Our participants, we do not label folks. They come to us and define themselves as a peer or not. But in general, a peer is someone who has lived experience as a mental behavioral health services consumer, family member, or caregiver. Propel understands that the traditional career counseling approach is not effective when we're working with peers on their journey to enter the peer supportive workplace. And what I mean by that is that for decades, the availability of, I guess, what has been called in the past kind of career services, come in and we'll help you with your resume, we'll prepare your resume, we will help you write a cover letter. We might help you find a job in what ways they're varied, but that is not the kind of services that we offer as a workforce development program. What we are doing is we are focusing on the individual and understanding what potential barriers, both physical barriers as well as some of the barriers that we adopt through our lives as peers with lived experience. And so our job is to understand what some of those things are and be able to help our peers overcome those and move into the and help them achieve the goals that they're trying to achieve. So talking a little bit about advocacy-based counseling, as I mentioned, we have evolved into this model of advocacy-based career counseling. But in order to set the stage, I wanted to share a little bit about what um, a typical advocacy-based counseling model looks like. And as is mentioned here, it is advocacy-based career counseling does fall within the case management and therapy kind of models, as you can see in the graphic that is on the screen right now. So examples of advocacy skills would be safety and support planning, systems advocacy. What we know is that in order for ourselves to find meaningful life supportive work, we have to have the underpinnings of safety and security in place. And that is housing, that is food, that is transportation. And some of that comes from systems advocacy and navigating institutions. We also know that there are other things that come up with our participants, things such as losing benefits, that if they are working, they may have fear of making a certain amount of income and losing benefits. So it is important for us to understand what those things are and help them understand the nuances and help, I think, in a lot of cases, managing fear around that. So the other part here and examples of our counseling skills definitely include reflective listening and support around self-esteem, identifying boundaries and clarifying. And I'll talk a little bit more about boundaries, both within the scope of the individual peer, as well as boundaries that we need to set as peers working in assisting folks becoming peer workers. And then self-care skill development. Again, this is something that we definitely support folks with, and that we also use these skills within Propel to support our peer workers, which we are. So we'll go kind of into what our advocacy-based career counseling looks like, a little bit more about the particulars of advocacy-based counseling, that we are providing person-centered always care and about the well-being of the participant. We promote and support a participant's efforts, and there is many times a start and a stop process with some of the participants that we engage with. And so it's about recognizing those little things that people achieve and helping them build on those self-confidence events, and also advocating for the participant. Many times we'll talk about this more later as well in the actual quest or search to find a suitable position for a peer in the workforce. It requires a lot of advocating on our part. And that means potentially advocating with the participant, part of the support for them, building their level of confidence, advocating for them that they can do it, and then we may need to engage with the actual employer that they're going to be applying to, or so this is kind of the advocating that we're doing. We try to inspire our participants, and as I mentioned, we are all peers as well within our programs, and so we like to be able to set an example. We like to be able to inspire participants by saying, if we can do it, you can do it for sure. And then also, one of the biggest parts of our job is helping participants identify the barriers that they will come up against. As I mentioned already, internalized barriers, and I also add fears to that, as well as the real external barriers that that we all face. So a big part of our program are our peer workers within our program, Propel, and they are employment specialists. They do just that. They are specialists in all things regarding employment related to peer work. And this is just absolutely, I can't emphasize enough how essential the folks that support this program as employment specialists are. And so what we do, the success of our advocacy program requires, and I don't like to use those kinds of words very often, but it is a requirement really that we all adopt a social justice perspective, and that we use culturally responsive and relevant language. We work with each participant individually, and know that each individual, we don't have a cookie cutter um, template for the folks that we work with. We get to know them. We understand that what their particular barriers are, where they are out in life. We actually engage with many people who come to us without really knowing what they want to do. They've heard about peer work. They've heard about the opportunity to destigmatize their lived experience. And so we work with them to individually develop career plans that's unique to them. Again, reinforcing their autonomy and self-determination, supporting their self-confidence and self-awareness, and then again, going to the barriers and challenges that they may encounter in the work and the career goals that they have. So the employment specialist work is very challenging and multifaceted. It is it's a heavy responsibility. And so I just wanted to be sure that if anyone's here exploring maybe what can we do to enhance our program, or potentially some best practices, I wanted to be sure that we are talking about the work that our employment specialists do. So let's talk about a little bit about reducing barriers to success. So in the advocacy-based career counseling that we've talked about, identifying the barriers is a primary goal. And we can start to plan from there. But we know that peer jobs require digital skills and access. And we have also learned through our journey that many folks need financial assistance or financial support as well. There are many barriers that come up for us, but for the purpose of this particular discussion, we're going to focus on the digital literacy and access, also known as the digital divide, and also the financial barriers that folks encounter on their journey to enter the peer workforce. So knowing that those are challenges, we had to ask ourselves, how can we how can we bridge this divide? What can we do? Um, and what we are doing, based on those questions to ourselves, is we've developed a program that gives uh, engaged participants. We'll talk about that a little more later. But a participant who is engaged with us, who has a career plan in place, and who is actively working with us, they are eligible to participate in our Drive laptop access and gifting program. And then related to financial assistance, what we have found is that we might have a participant that we are working with who potentially does have the technical tools that they need, but there may be barriers related to internet service. There might be barriers related to electricity where they are doing their training or job searching. We also know that there are significant fees related to registration and exams for Medi-Cal peer support specialist certification. And so those are things that we've identified as being primary barriers that we wanted to talk about today. The first thing that we'll focus on is going to be the digital divide. And this is something that is a profound barrier for many of our peers that we work with who are attempting to enter the peer workforce. And we'll talk about it. So the digital divide is the gap between those who have access to modern information and communication technology, right? Our laptops, our phones, our you know, fill in the blank, and those do not. And so, as I mentioned, access to technology, digital literacy, affordability, and the relevance of content. And I think that the relevance of content is actually an interesting uh, bullet point here because the relevance of content is sometimes directed at an audience in an attempt to naively address their understanding as opposed to addressing their actual needs. I had done some research on that, and I think it's really interesting, something that we could potentially talk about as we're wrapping up. But the digital divide can also play a significant role in an individual's physical and psychological health. Um, we know for a fact that the lack of digital access is recognized, excuse me, as a super determinant of health. So not having access to digital technology could potentially prevent us from being able to have medical appointments online, meaning the actual interface with the provider. It could mean not understanding what the benefits are that you receive from a particular program. There, you know, just fill in the blanks. So our our world today really provides the tools and the again 19 million people in the US lack reliable broadband service too. So just another in you know, kind of note there regarding the digital divide. So that's profound. Okay, so now we just wanted to talk a little bit about how we have identified providing digital access can help peer workers. So if we reflect back to the slide where we talked about identifying some of the major barriers related to peers entering the peer workforce, we can talk about the specifics. how digital access can help peer workers. This was some things that we considered as we started to evaluate how can we really what kind of program can we develop to really make a difference and help us get folks from uh, engaging with us to the achieving the goal, which is entering the peer workforce. And so that is going to be, it's going to help them with training and professional development, communication and networking with their peers, resource sharing, access to mobile applications and tools. And I think one of the biggest bullets here is going to be remote work options. So, this is another topic for another presentation, but related to remote work. We know that there are a lot of peer workforce opportunities that are done remotely. And by not providing digital access, we are limiting very, I think, a big portion of the peer support workforce opportunities. So again, we've addressed this through Drive Laptop, and we're going to talk about another program that we mentioned in the beginning, and that has been helping us bridge the digital divide, and that is a DEI program, Tech at Hand. Um, so how did MHASF get into the digital access arena, or how did we start to engage in this kind of work? So this really was born of an innovation grant, pardon me, that allowed MHASF to help address the digital divide in San Francisco, primarily with the TAY and transgender adult community. So that gave us the opening and the opportunity to explore and start to understand um, what we could do, where we could make an impact, and it really made an opportunity for us to grow a big portion of our department as well. And this was at that time a program called Help at Hand. And the primary purpose was to increase access to mental health care and support. Um, so moving into the next slide, we'll
Hey
talk.
Dee Dee,
Yes,
sorry to interrupt. I've had a few requests. If you wouldn't mind, it's up to you, obviously. If you wouldn't mind minimizing the notes section so that the slides show up bigger.
I'm sorry. I thought my main presentation slide was on the screen.
Oh,
I apologize. Let me re-share my screen. Is that my main screen now?
yes, yes, yes. That's great.
That's unfortunate. I apologize.
Oh, my apologies. I thought it was intentional. I'm so sorry. I didn't mention that before.
Yeah, no worries, no worries.
All right. Yes, sorry for the interruption. Please continue.
Yes, thank you. Okay, so talking about the Drive program, this was a program that was born organically from the Propel program, and it was a baby born, and we nurtured it, and it was quite a long process. It took us months to develop the basis for this program. I'm really proud to be able to talk about it in the presentation today. So there are, again, there's words here that sometimes are, a little uncomfortable, but there are expectations that we do have for participation in this program. And the first is the participant must be actively engaged with their employment specialist. They have to have regular meetings. They have to have their goals established. They need to be identifiably engaged. The next is that they have to either be actively looking for employment in the peer workforce, or enrolled in the Medi-Cal peer support specialist training program. So typically what happens is a participant will engage with us. We have a welcome meeting where we get to know them, they get to know us. We identify what they're really looking for. I guess the best case scenario is that they are desirous of getting Medi-Cal peer support specialist training and become certified. Some people come to us and are undecided and really just want to start looking for work in the peer workforce, and that's okay. Um, but the folks that are eligible to participate in the Drive program need to be in on one of those two tracks or both at the same time. And then to be eligible for what we in this slide is ownership, we actually call it also a gifting program. That in order to be eligible for the gifting program, they must pass the Medi-Cal Peer Support Specialist exam that's offered through Cal Mesa, um, and or gain employment while engaged with an employment specialist, and they are required to be stay employed for a minimum of 3 months. Many of you know who may be working with the Medi-Cal Peer Support Specialist grants that are out there. There is a 6-month retention requirement for people being placed in jobs. And we find that that is a little too rigorous to be able to actually, you know, reward the participant for their hard work. And so, although we do follow all of our participants for at least 6 months, once they become employed, they are eligible for this gifting program at 3 months. So that is a solution that we have provided, and we feel like it's a really good solution. And we know that we have a lot of folks who are really excited to take advantage of this as well. Um, and I would almost call this a best practice. Bear with me here. Okay, so our Drive program features, we have laptops that are loaded with security and tracking software as a solution. Our program began with 10 laptops. We did eventually have to add more inventory to our program, which was a good thing and is a good thing. But the one thing that we did in the planning, as I mentioned early on, and really designing this program to really fill the need, we know that looking at a 12-inch laptop screen during training, job searching, creating, working on your resumes, all these other things that folks need to do, that screen is too small. So we asked ourselves, what can we do? And so we went with a larger laptop screen. It might seem like a small detail, but it's actually it's actually a big deal. So we have 15-inch laptops. We also supply supportive equipment. So that includes a wireless mouse and keyboard, a speaker, and a carrying case. And we do this because we know that, again, this, remote work from home environment, working on a small laptop is limiting and not conducive. So we do provide those other accessories in this program, and those are part of the gifting program as well. We also spent a lot of time developing the program handbook. And this is something that is provided to the participant when they engage in the Drive program. I'll say just a little bit about how they engage. So we have a very rigorous handoff protocol for our participants. So once they have qualified for the Drive program, they've been approved by our employment specialist team. They will then come into the office. They meet with a digital peer navigator, which we will talk about in a moment here, as well as their employment specialist. They work with one-on-one. It's kind of an event, it's a big deal for everybody. And we not only provide the laptop, but they get some digital literacy, kind of an overview, make sure that they know how to use the laptop before they walk out of the building with that laptop in hand. But so the program handbook, the reason that I kind of digress there a little bit is just to explain that when they come in, they're given the handbook, and we make sure that they understand that they can go to the handbook for information. They're not lost out there if something, for some reason it's not working or they can't access something. So we've made it easy to navigate. We have included all the information about the program that they've previously been, we've talked about with and have covered with them. We want to make sure that there's always an opportunity for them to go back and double check. Hey, what do I do if, right? Um, and then we also let them know that these devices do have tracking and security software on them, and that there are technology tools in place to provide for personal safety, and so these things are important for us to be able to communicate. And I think that it's important for me that people understand that we're not trying to um, spy on them, keep an eye on them, but this is so that we can make sure that there is safety related to the digital technology that we are sharing with the participant, and so that's really an important part of it. And then the participant agreement, once they do come in and they've met with the employment specialist, we've done all these things that I just outlined, they are engaging with it in an agreement with us, and it does formalize the program expectations. And it also sets out the pathways for the gifting program that I've outlined as well. So again, great program for us. Our participants love it. They're super excited. I will say that, and I'll talk about this a little bit later, that there were some challenges for us in rolling this program out. We spent all this time up front making sure that we were doing everything that we needed to accommodate the needs of the peer of the participant. But we did encounter some issues when it came to the SaaS solutions. A lot of people had to get involved to make this work. And so it has been it's been a journey for us, a learning experience, but we're really excited. Things are really moving forward. Okay, so moving on to the Tech at Hand program. As I mentioned earlier, Tech at Hand was part of the program Help at Hand. Actually, it evolved from Help at Hand. And what Tech at Hand does is they actually address a little bit of a different community than we do with Propel, but we do have overlap of our participants. There are folks who will be referred to the Tech at Hand program from Propel and vice versa. Tech at Hand's primary technology are tablets. I believe that the first couple of cohorts that they had were primarily tablet based, and have now transitioned to iPads. And this does allow bridging the digital divide to a community who may be more apt to want to travel with their digital technology. So this is the population or transitional aged youth, 17 to 24, or socially isolated transgender adults. So the 40 iPads that were distributed to the cohorts for 6 months. They are equipped with T-Mobile internet hotspots. Again, this is kind of like the nature of this particular digital technology. And then the participants agree on three goals related to digital literacy and mental health whenever they are engaging with the Tech at Hand program. And this has been a very successful and very needed program for this community. Mental health resources, they do receive one-on-one peer-related emotional support, much like what we were talking about with regard to employment specialists, where we are really, all of us, invested in supporting the individual and what their needs are related to our services that we are providing. And then also, as far as referrals and finding support and mental health resources, that's actually very broad. We are we are not in, with regard to Tech at Hand, we are not a direct services provider, but we do a lot of referrals to direct service providers so that the participants in the Tech at Hand program know where to go to access other services that can be supportive of the needs that they have. And again, this is a very successful program for Mental Health Association of San Francisco and under the umbrella of DEI. And this is leveraging or based on what I was just mentioning, which is um, that sometimes participants at Tech at Hand and Propel benefit from the services of the other program. If there are Tech at Hand participants who may need, let's say, assistance with need financial assistance, they might need help with a utility bill or with a phone bill. That person can be referred to Propel. And once they've engaged with us, then we can go right to work helping them with the needs that they have related to financial assistance. And Colin, I just wanted to say quickly, I think I'm getting some texts from people here that say they might be, is there a waiting room? Or there's some difficulty maybe in getting into the presentation. So I'm just gonna move on. You can see if there's anything you can do to help there. Um, and so just also talking about the way that we engage with folks. We are very proud to say that we collaborate and we support our participants holistically. This goes back to talking from the very beginning about really understanding the needs of the individual and helping them with barriers that they may be encountering with regards to accessing services and entering the peer workforce. Um, so just by allowing also participants to um, engage in multiple programs within MHASF, we are not leaving folks in a situation where they feel like they need to go to another organization to get the services that they need. Now, it might come to a situation where, with our assistance, we determine together that, hey, this is not something that we can provide to you, but we know where you can go to get that. That's a different kind of situation where someone is just kind of left hanging. They don't know what to do next, and so they go someplace else to try to find the services that they need. Um, so, want to talk a little bit about now Medi-Cal Peer Support Specialist training, certification, and peer work. Again, I know that many of you probably are well versed in Medi-Cal Peer Support Specialist training through Cal Mesa approved training vendors and the state exam. So we just wanted to talk a little bit about how our programs can and do help navigate these particular objectives. I'm just going to take a quick sip of water. Bear with me. All right. So talking about Propel successes, we, as I mentioned, this program has evolved, and in doing so, we have been able to learn from the successes that we have had, as well as challenges that we have encountered. And all of our programs, again, something we're very proud of, they are all organic. They have been born and nurtured by our internal peer workforce. We identify a need and we collaborate. We work together. We figure out what can we do as a team, as an organization, to provide services, excuse me, that are going to fill a gap. And then, so some of our highlights and some of the things that were really important for me to be able to convey today is that we embrace the fact that we are peers too. This is very challenging and sometimes difficult work that we do, helping folks. And we need to be sure that we practice self-care, that we give each other recognition for the successes that we've had, and that we also support each other when things are difficult, perhaps. And we always want to make sure that we are taking care of ourselves, because if we don't, we know that we are not able to care for others. And this is a big, big piece of Propel. The development of our advocacy-based career counseling program, we have evolved in things like very obvious changing our language. We don't call the folks who engage with our program clients. Um, they are participants, willing participants in our program, and they are peers as we are peers. We have also developed I think that a lot of us are used to the words case management. And one thing that was said the other day in one of our discussions, which was really profound for me, was that people are not cases, right? We are people, we are individuals. And so we have changed the way that we talk about the way that we manage the groups of folks who come through our program. And so this has been part of our evolution of how the words that we use, because they are so very important. The development of our Drive program from the ground up, as I mentioned, this was an organic program that came from the identification of the barriers that the peers that we were working with were facing. And we needed to have solutions. So, with the support of our leadership team, we were able to eventually implement this program. And then the other thing that we do, Propel, which is really an interesting item that I wanted to put here as a success, because it is success for us, is that we support internal MHASF broadly in their journey to become Medi-Cal peer support specialist certified. So this is a program that we operate internally. It involves us being able to engage with folks that we may know in our everyday lives and our work, but also need help and support on their journey to become certified. And we're really happy to, have had a good number of folks within our own organization go through this certification, become certified, being able to use the credentials and their titles. It's the future of the peer workforce. So it is something that we're really proud of. And that is in general our knowledge that what we're doing is shaping the landscape of the future peer workforce and the peer workforce initiative. And something that it's been a journey. And then talking about challenges, we definitely have had those. We've had things that have manifested for us that we did not anticipate. Uh, and So just some insights about the challenges that we've had. We The collection and understanding of real-time data about our program is so key to us making good decisions. And this is everything from what our staffing looks like, how many employment specialists do we need to support folks in the advocacy-based career counseling model. It might be different than if you are just meeting with people once and saying, hey, let's update your resume real quick, and good luck with that. So it is a more complex staffing model, and without understanding the data, we could not make good decisions. And we can't have a lag in our data either. So me collecting data from 6 months ago does not help me make a decision today. I need to know today what happened last week. And we do that. It has been a challenge for us. We've had to go through several numerations of technology tools within the organization to be able to collect the right data in the right way. And so I think that for any organization that is struggling to understand what they need to do to be successful in this peer workforce initiative, that would be one of the biggest challenges. Now, I will say that we have I think we're pretty close right now. We are, I would say, almost there with regard to the collection of our data. And so, definitely a challenge in the beginning. Adding the right team members at the right time is also a challenge that we needed to step back and really evaluate. So there's really two pieces to this statement: the right team members at the right time. So our staffing and hiring processes have evolved, and that includes our knowing that a person who identifies as a peer, um, that is not a sole qualification for being able to get to be a part of a team that is so dynamic, that is helping so many people with different challenges and barriers. And we really need folks who are willing and able to pivot, and we do make a lot of real-time decisions. Hey, this isn't working for us, and we're going to change it, tomorrow. So these are the kind of folks that we're looking for, who and who can go with that, who are not, um, uh, really devastated or stopped in their tracks whenever an organization has to make a key pivotal change in such a short period of time. So those are kind of the right team members, and at the right time too. By collecting the data, we are able to make better decisions of when is the right time to add staffing. And so those two items really work hand in hand. We also know that there are, at least in the traditional way of looking at peer workforce roles, where we are trying to help folks become part of the peer workforce, that there are limited workforce roles, and especially whenever we talk about many organizations with the same goal that we have, which is placing folks in the peer workforce. It almost had seemed at times that we were all competing for the same work for our participants in our programs. So how we overcame that is we had to say, hey, we need to broaden our scope in the way that we look at the work that's available out there. Every uh, peer supportive role, is how I talk about it a lot, is not going to be called a peer support specialist. We know that. I mean, gosh, we know that there are so many titles that can apply. We also are looking for opportunities to make sure that for-profit organizations are, I say this, put their money where their mouth is. In other words, you might be a big corporate organization who says that you embrace DEI, but yet you won't hire a worker who has a justice involved background. And so our job is to bring that to the table, to say, hey, we're going to challenge you on this, and we have this kind of like initiative where folks can become certified, and we really have their self-confidence and a lot of the barriers accomplished. And then, why do I want to put folks out there in work in a work seeking work who are going to come up across these barriers? So we're really working at breaking down those barriers and helping folks understand what we're doing. And that's a way that we've started to address that limited peer workforce role. And then keeping participants engaged and motivated immediately. So, excuse me, when we go out into and we excuse me, attend events, we engage with folks who are interested in our program, and it's relatively simple to get people to sign up for our program. Our application is pretty easy. We are able to talk about the benefits of our program, and people get excited. But if I go to an event and I have 20 folks sign up, let's say, it doesn't do me any good if I don't respond to their interest soon, like right away, if at all possible. But we know that we need to engage those folks within 48 hours. And with, kind of tying this all together, so depending on what the capacity is of our workforce, our employment specialists, we have to balance that. So, how many people can an employment specialist work with in a advocacy-based career counseling model right away? So, we need to be able to have systems in place within our department that allow for us to be able to, at the very least, acknowledge in a very personal way to the individual that we have received their application. Here's what the next steps are. And our goal is to be able to have them meet with an employment specialist within three business days. For the most part, we are successful at that. But again, what we do know is that those folks that we don't engage with immediately are probably going to be engaging with other organizations. And we don't want that to happen. If they were interested enough to fill out, an application with us, we want them to know that it's important to us that they did that. So that's been a challenge, with the staffing and the models we have and balancing everything. So something to take note of. And then overestimating our capacity, our employment specialists. This is kind of more about what I was just, talking about, is that our staff internally, this is very, very hard work. And it's, emotionally, psychologically, and physically draining sometimes. So I want to make sure as a leader, and adhering to my moral principles, that our program capacity is enough to be able to accomplish our goals but still be able to care for our team members. And so those are things that we have noticed that we have noted as challenges. And, we work through things. We do. Our team is really collaborative. And when we identify a problem, we go to work on it. So one of the last things that I want to talk about is a case study. So this is kind of bringing together everything that we've talked about. There's a lot of text on the screen here about this particular participant, but just in general, so this participant of this case study was a longtime resident of San Francisco and had challenges with addiction and housing for most of their life. Um, when they came to us, the objectives that we identified were to complete the Medi-Cal peer support specialist training, to pass the exam, and become employed in the peer workspace. The word gainfully employed is important there because some of the other work that we do that I haven't talked about is when we're helping folks identify employment opportunities in the peer workforce. We know that there are organizations out there that are not offering enough on an hourly salary basis for an individual to support themselves, and especially in the San Francisco Bay Area. So gainfully employed to us means that they are working for an organization that supports them through the benefits that they offer, through the salary that they offer, and that they also have a peer supportive environment. So that's what gainfully employed means here. The challenges that we identified through working with one of our very experienced employment specialists, this person lacked digital literacy skills, not completely, but needed some help, and they did not have the technology tools that they needed to do the training and job searching. And then the success part of that is that they did all of these objectives. They accomplished all of these objectives that were set out for them. And it didn't take very long. It was over a period of less than, well, they started in July of 2023, and they're currently working. So this is just one example of the kind of success that we're having when we go through the entire kind of reflecting back on the presentation that we've had today. These are the outcomes that we desire. And we know that if we follow the model that we've put in place and we continue to refine it and we continue to ask ourselves questions, how can we do better? That we can have these outcomes. And it makes us really happy. We celebrate internally when we have these kinds of successes with participants. We celebrate with them. But this is the goal. This is where we really want to be. Nirvana, I guess, is what I would call it. So, in summary, another apologize. So in summary, our advocacy-based counseling does work. We know that. And just to reiterate, this is not just an awareness, this is action. Everything that we do, we try to base it in an actionable kind of we frame it in an actionable way. We do know that team members, both in Propel, Tech at Hand, DEI, all of MHASF really identify as peers. It's an essential part of our program. We when we hire for open positions, um, we really make sure that the person that we're talking with is not just a peer also, but that they are also a peer who can identify with the work that we're doing. We know that the digital divide is significant, and that is why we have developed the digital literacy programs and digital access programs that we have, Drive and Tech at Hand. Um, and that the other thing that we talk about a lot is validating, legitimizing lived experiences, our lived experience, our participants' lived experiences. Um, through the Medi-Cal Peer Support Specialist certification and peer work. And I just want to say that one of the things that we really lean into when we're talking with folks about this program is for many people who have been through recovery process, who have had struggles throughout their lives, and potentially education could have been a barrier in the past. If someone comes to you and they're talking about, hey, I want to change my life, I want to work in the peer world, and you say to them, oh, you can get your, CADC certificate, your, alcohol and drug counseling certificate. It's going to take you 2 years. And immediately, it's just overwhelming, right? It's another barrier. I've never been successful with education. I fill in the blank. But, this is a program that is short. It's done in 80 hours. It's done, depending on the program in a limited number of weeks. And so to me, that is a lot of validating of the lived experience that we have. It's acknowledging I'm not going to do a 2 year program. I'm not going to get my master's degree, but I can do this 80-hour program. Um, and then also that Propel invests in the participants that we work with. Our job is to promote their growth, their well-being, and to propel them in this journey that we have, that we are taking with them. And so that is kind of coming up on my hour here, and I'm really, really happy to have been able to talk about the program with you. And I'm happy to answer any questions that you might have. All right. Colin, I know we have an hour, and I finished a little early.
Yeah, we have until a little
10:15.
before 10:15. Yeah.
So I'm happy to also take any individual questions. I did, and there are our QR code for mental health, Propel at mentalhealthsf.org. This is the QR code for our application. But you can also shoot us an email at propel at mentalhealthsf.org. And we are happy to get back to you directly as well if you have any questions. Giselle?
Hi, good morning. Thank you so much for the presentation. I love this program. It sounds just empowering for peers. So thank you for presenting that. I have a question. Is it just, do you just offer this program, the Propel and Tech at Hand for San Francisco residents, or do you do any online offerings? I'm down in San Diego, and just wondering if that's offered to anyone throughout the state, or are you sticking more local?
Our programs are available statewide. The Drive and Tech at Hand programs are local, meaning that we engage with folks directly one-on-one. And so that is a barrier for a statewide program, but hope, we do hope in the future that we will be expanding our program to Southern California.
Thank you.
You're welcome. Kimberly?
Hi, thank you for the presentation. I have a question. I know Mental Health Association of San Francisco has a pretty well-known program with hoarding, and I was just wondering whether you get peers um, helping out in that regard. Are you training peers specifically for that? What do you know about that program?
Well, you're right. It is one of the biggest programs that MHASF has, and we are well recognized for. What I can tell you is that the folks that we work with in Propel, that we advocate for and work directly with other departments at MHASF if there are openings and opportunities to get them into, hired at MHASF. So I'm not sure if that answers your question, but I will tell you that we've been really successful with our Propel participants and having them transition into full-time and part-time employees at MHASF.
Yeah, absolutely. That answers my question. Thank you.
You're welcome.